I'm sitting with Benjamin Asher, medical doctor who is licensed in New York and in Vermont. Welcome, Dr. Asher.
Thank you very much.
Yeah,
Happy to
uh,
be here.
great. I'm so pleased that you're willing to introduce some concepts around ketamine assisted psychotherapy today. I'm sure the audience will be really appreciative of an introduction. So if you wouldn't mind just starting out with what is this ketamine assisted psychotherapy, and we'll try to give it a nutshell experience for people listening.
Right. So, in the context of mental health and ketamine, one way that people are receiving it is just getting intravenous infusions of ketamine as a way to change their brain chemistry. And so, for people that have treatment-resistant depression, people are going to infusion centers and getting an infusion twice a week for 3 consecutive weeks, and that is supposed to help with depression in some people, and it's becoming more and more popular. When we talk about ketamine-assisted psychotherapy, it's actually having a therapy session while on ketamine. So a person comes in to see me, and I usually do this with another therapist, and we give them an injection of ketamine, which alters your consciousness so that you're more open to your own inner experience of your life. And there's not so much resistance to experiencing yourself. And things come up, and one is able to process them in a different way and get different kinds of insights about different issues. And it can have more of a psycho-spiritual element to it, because there are parts of the self that can come out, and parts of the ego can be a little less holding on.
Mm. I've heard people say that things can come up and be accessible to them that might otherwise take months and months of therapy to get to.
Yes, that's I would say that's absolutely accurate. That there's just a general ketamine it's considered a dissociative, but not in the negative sense that you're out of control or dissociated from yourself, but it gives space. It gives space between you and the issues that are up, and you can have a perspective on them so that you can look at them with, I would say, more compassion. Often, your heart opens up to yourself, and you can have a different experience of things.
So that means it could really be helpful for people with PTSD, post-traumatic stress disorder.
Absolutely. People with PTSD, people that are feeling particularly stuck. And in the area that I'm interested, particularly, is in people that have chronic illnesses. Because I'm finding in my practice that I take care of a lot of people with Lyme disease and tick-borne illness, and people are just feeling generally stuck. And a lot of patients that are in that category have had trauma. Either their trauma is in the medical trauma, that they've been so traumatized by the medical system that that is a trauma in and of itself, or they have a past history of trauma. And ketamine is very helpful with that. And something which I know you're absolutely aware of, but people who are listening may not be, is that people really are not aware of how much trauma we carry. And people often, whenever I ask a question to somebody, have you had any trauma in your life? They often say, oh, I've never had more trauma than the next person, but they don't know what that next person carries and what people's standard for trauma is. I've actually had women say to me, does sexual assault count as trauma? People don't put that on the list. I've had people say, have a child die count as trauma? And so it's the way we internally look at these things, and the standards by which we hold ourselves is sometimes so extraordinary that we can't even deal with these deep issues.
Yeah. So having some kind of safe medication, FDA approved, that can allow us to go into this area and yet not have to relive it, but be able to look at it from a more neutral perspective and deal with it in a way where we can move past it, so we're no longer held in the grip of it. That can be just hugely significant for people.
Absolutely. And I look at things often from just sort of thinking about something as an energy perspective, and that there's an energetic knot per se. And when you can open up into what it is and not have to be stuck and holding it so tight, that knot can be released and people can feel more whole.
Yeah, great. So it is FDA approved. I think back in 1970, it started to be used approximately as an anesthetic, not
that's correct.
Psychedelic-assisted therapy, but
Right.
anesthetic. But so we're talking about a legal substance when a medical
Absolutely
doctor is present, and we're talking
right.
about a high degree of safety. But
Absolutely.
what are the risks? Are there any risks?
There are some risks. One is it can elevate your blood pressure during a session. So if somebody has uncontrolled elevated blood pressure, it would not be a good idea to do a session on ketamine. Ketamine used as a not in this kind of a setting, but just over and over again, there can be some urinary tract issues that are associated with overuse of ketamine. Mm-hmm. Some people can experience their heart racing when the medicine sort of starts working, and some people can feel that that's unpleasant, and you just kind of have to work through that. There are people that don't like the experience and can feel somewhat panicked, but if that is the case, we're sitting with two guides who are sitting there with you and holding space at that time, and help a person work through that when that's happening.
Great.
So,
but also as a medical doctor, you've got a bag of your medical doctor bag with you, right? In case
I do. I actually keep all the. Nausea is also another thing that can happen.
Yeah.
Yes, I have in my bag some medications that can be given if anybody has a problem mm-hmm. with it, and I haven't had to use any yet, but I keep it there.
That's wonderful. Wonderful for safety.
Right.
So is there anything else that you feel might be important in terms of just introducing the risks, the benefits, outcomes of the ketamine assisted psychotherapy?
I think that the point that you made is that really, I think, could be re-emphasized, which you can really be open and move through things in a more quick way with this kind of a process. Because it's not really working on the level of the mind and going over and over and over again the experience of whatever it is that you're working with. But there is a deeper layer that gets opened up, a deeper layer, which I would call wisdom, mm-hmm. that allows us, or that we're being held in and we hold, that is opening us up to ourselves, that really helps us to move towards greater freedom. So that's what I would say.
Yeah. Well, in my brief experience getting to know ketamine better, it seems like there's a huge aptitude that it has, or capacity that it has, to bring people into higher states of consciousness as well. What a fabulous way to go. Not only healing on a psychological level, but also moving into a higher state of consciousness.
Right. And it's totally legal, which is, one of the great things about it.
Yeah. So thank you. I know that you're going to be starting doing the ketamine assisted therapy in Vermont, and that you are at this time also doing it in New York City. And yes. I'll put your contact information below this video so people can contact you if they want. But thank you so much for giving us some of your time today and introducing this audience to you and also to the ketamine assisted therapy.
Thank you so much. Appreciate your time.